Good morning. I am Brigadier Dr. S. M. Sharma, surgeon, and today I want to talk to you something about COVID-19 disease. These are the trying times, and our nation, our people, elderly men, women, and children, they are suffering today. And I am not going to talk about the symptomatology of the disease, which I've already talked, or the treatment or investigations. First and foremost thing I would like to tell you, and as you know, that lakhs of people are getting infected every day, and lots of people are losing their lives also. And many of us are giving their best in the service of these people who are suffering from COVID-19. They are helpless, and they are risking their lives, and they are sacrificing their lives. So our respects and tributes to those doctors and nurses and paramedical staff and all those people, all those volunteers who are helping others at this juncture. Many of the people, they are even cremating the bodies at their own cost. So in this country, there is no dearth of great people and good people who are doing so much for the mankind since time immemorial. There are lots of people amongst us. That's the reason, we are surviving as a nation. Whatever the cause, whether it is during pandemics or it's during the war and battles, our people have never lagged behind. So we pay our tributes to those people. Many of my colleagues, they have fallen sick, and few of the people have lost their lives also. And as an individual, it is my first and foremost duty as a doctor to give free consultation to all those people who seek my advice, number one. And second, whenever I am called to home, I make home visits also, knowing fully well that these people are suffering from COVID-19, and not charging anything, because this is not a time when we make profits out of the misery of suffering people. However, of course, those who are running institutions, those working, and one has to survive in life, and therefore there is no harm when a person is accepting money for the sake of his honest, dedicated work. That is a different thing altogether. But on the other hand, I would like to point out that it's very, very sad that doctors, the senior medical students I'm talking about, they're working full time, and they are on call duty also. They are being proposed to be given rupees 3,000 per month. I leave it to those people, the leaders or whatever you call, and the bureaucrats, that they have, valued the services of these medical students or doctors for rupees 3,000 per month. This is for them to see how good national spirit they have, and how much patriotic they have, and what is their consideration and attitude towards doctors who are fighting out the disease. Anyway, that's a different issue. There's no harm pointing out these things also. Now we have second wave of coronavirus, COVID-19. The first wave was tackled successfully, and there's some kind of a laxity, we became a little careless. And as a result, the second wave has struck in such a way that it's really caused immense sufferings to the patients. It has caused immense sufferings to the family members also. Not only that, there have been so many complications associated with the disease. Now, whom shall we blame for this kind of neglect? I personally feel that social gatherings were there, religious ceremony were there, and some political activities were also there. But it is the responsibility of the individual not to go to such gatherings, number one, and they should have been putting you know, masks, at least, if not two, at least one good quality mask they should have been putting on. But it was very sad to see in such, just 1.5 months back or so, people were moving around without masks, roaming around, and there was no consideration. There are no precautions, no precaution was being taken to avoid this disease. Now, this disease has come in such a way because this is a mutation now in the virus. Now it has started striking the younger lot also, younger people, even the children. Earlier, the elder people by and large, and people who were having some more comorbidities like diabetes or hypertension or kidney disorder, respiratory disorder, they were the victims. Now this is striking suddenly and abruptly. Suddenly it has come as a bolt from blue, from the sky. A person who was absolutely all right is suddenly falls sick and loses life also in a short period of time. That's a very sad thing. This virus, as you know, has come from the wet market of Wuhan, and it spread to our country because those people were infected. They came to us and they infected a large number of people. Anyway, I was surprised to, shocked to hear when I started receiving telephone calls also for admission to hospital. So I was off because I was busy earlier with my sickness of my family members, and it was very, very difficult to arrange for the admission of all the family members in the hospital. The demand for oxygen came up, people were not getting oxygen, they were not getting admission to the hospital, they were not getting drugs, there was nobody to take care of the family members. Now, in such a situation, what do? The children are not staying with the family members. The children are far away. Sometimes some of the children are away from the country also. So these kind of, you know, problems people are facing, that there is nobody to look after them, nobody to take them to the hospital, and nobody to care about them. This is a very sudden thing. So this gives an idea for us that we must be prepared for anything, any kind of a pandemic or any kind of a problem in future. God willingly, such things should not happen. But still, along this virus now, a very sad thing is that, opportunistic infections, they took over. People start self-medicating themselves without consultation of the doctors, which is not a right thing. For your treatment, one must have a medical consultation. There are indications when to do the CT or not to do CT, when to take antiviral drugs and when not to take antiviral drugs, when to take steroids and when not to take steroids. So self-medication is a very dangerous thing. And as a result, what is happening is these fungal infections have taken over. So I don't know whether these fungal infections are opportunity infections or is part of some kind of a biological, you can say, intervention or terror or some kind of a thing. Because this virus has come all of a sudden, which raises suspicion in the minds of the people. How come it has started, erupting all of a sudden everywhere? And it has come up at those places also where there were no gatherings were permitted. So, biological warfare means nuclear warfare, the biological warfare, and the chemical warfare. Now, three components are there: nuclear warfare, the biological warfare, and the chemical warfare. So one has to be prepared. If we are not vigilant, we'll have to pay a very heavy cost of it. And we should be prepared in future that what should we do if such kind of pandemic strikes us. You'll be surprised, some of the countries are hoarding in vials viruses, bacteria. In some of the countries are having the smallpox virus also. They're just to inflict injury on others, to harm others, to harm harmless people. And in our country, by tradition, we are the people who would not like to do such kind of a thing, to spread virus and go to some other countries, and through the collaborators, you try to harm people by using chemicals, and we have got a water supply system or things like that, or spreading virus. So this we have to think. We categorically cannot say that this is a natural occurrence, the second wave, or it has been a deliberate act on the part of some people, but we have to be prepared for future. This thing has to be kept in mind. Our youth has to be trained. You see that the only guardian which can save we people, the nation, is India's armed forces. India's armed forces. In a situation like this, when the civil population is afflicted with such a serious virus infection, pandemic, our armed forces, our security services, our police services, our internal security mechanism, the people have to be in a very good shape and health. So therefore, as a second line, our youth must be trained that a situation might come in future when youth may be called upon to save the nation, to defend the nation. So therefore, we must train our youth, not only physical training, but military training also. God forbid, thank God, our army is absolutely safe and healthy. But engaging army in all kind of duties to assist civil population during pandemics, who is going to defend the country in case that kind of a situation arrives when the armed forces personnel themselves get afflicted? It's all right, army never says no. It is our duty to help the nation in trying times, but however, the security, the defense of the country should not be compromised. And in future, suppose a city is afflicted, a city which is the place of governance, which is the headquarter. So therefore, we must do future planning and exercises where others can take over to meet this challenge. What I'd like to say is that those people who do not learn from history, they are bound to repeat it. We must go down back into our history and see what has happened to our country. If we are not historical minded, really I'm telling you, we may have to pay a very heavy price for it. So therefore, you must recognize who are your friends, who are your enemies. We can't make everybody enemy amongst us. But I can tell you this much, that one must be vigilant and should be prepared accordingly. Now, when such a kind of disease has struck our people, people are dying. It is very sad to see that some people, including media, they are trying to demoralize the nation because people are confined to their homes during lockdown. So they are not fully aware what is happening outside. So the media is the only way where you can communicate and get the latest news and some information. The media is particularly targeting and showing, what do you get when you are showing burning bodies? The bodies are burnt, no doubt about it, according to our tradition or whatever it is, burial or things like that. But does it make a sense that media is focusing on certain situations? We are trying to show that there is a collapse of the system. It is not collapse of the system. There are some problems, of course, no doubt about it, and we have come up very well. But what do you want to show? This is some kind of a vulture sitting on a tree and watching the bodies being burnt. Is it something worth showing? So this kind of attitude, why a person tries to humiliate his own countrymen, his own people, I have not understood that. That means there is something deeper to it. The attitude. The attitude has changed of some people who, instead of helping, instead of collaborating, instead of having a positive thoughts and a positive attitude, are targeting our own people, our own doctors, our own hospitals, our own governance. Is it the need of the hour? It's all right that there are certain lapses. It has happened due to some problems. But then this is not the way where we try to harm our own people by projecting the negative aspects of life. Yes, if you have some problems, yes, of course, come up. Help the government, help the people, go to their homes. But sitting in a room, closed from all sides, and dishing out, showing something and trying to influence the minds of the people in which they are struck with fear, that's not right. So we must not be a propagandist or some kind of a person who's sitting around to make profit out of this situation. It is well known fact that many of our countrymen, they receive lots of money and help and considerations from countries who are not friendly and sympathetic with cause. And many people are very happy about our predicament. You see the YouTubes and things like that. So many people are talking ill of our country, which is not a right thing. And sadly, these are the people who are our own countrymen. Where do we go from here? Now, this is a situation where people are suffering just because there is economic disruption to some extent. People have lost their jobs. The trade has suffered. The economy has suffered. So, therefore, we have to plan for the future in such a way that in such kind of disruption or what you call that intervention by pandemics or diseases or some turbulence or natural disasters or something like that, we must have something up our sleeves. Each and every family must have sufficient amount of money for the rainy day. In such situations, we should have some kind of a training and exercise and an SOP where people can be translocated back to their homes and places of work or something like that. And we have got sufficient quantity of food grains and a mechanism whereby in such a situation like lockdown, we have some kind of a voluntary force or an institutionalized force where people can be provided with grocery and provisions while they are inside their homes and they don't have to expose themselves by going out into the open. We have seen a very peculiar situation here. Many of the children, many of the families, their children are not here in this country. They're working abroad and there's nobody to look after them. There are some families, they do not have children. But this came to our thought. Had one of the child been staying with the parents and families, probably he would have been of much help to the elderly people. We have one child norm with a two child norm, but I believe, this is my personal idea and thought, in a situation like this, in for future also, it will be quite appropriate if our families have three child norm, three children. So at least one of them will stay back at home. When the two children, one son goes abroad, the other one also follows him, and there's nobody back here with the elderly people. Even if they are not elderly, even then, I suggest that for such a situation, we found those people who have got three children, the sufferings are quite less. Anyway, the thought for this is a social decision and a family decision. Another sad thing which we have observed here, there are all kinds of people. There are very good doctors who are helping out people. They are not accepting money from patients. They are dispensing medicine for free. But there are some people who are making profit out of it. Whether it is oxygen cylinder or it's the medicines, these are not the doctors alone. There are some other people who have indulged in profiteering, black marketing, selling a cylinder at a more than 100% profit, and and making use of the suffering of the people. Like a person who has already died, now to take this person from hospital for cremation, the ambulance services, the private ambulance services, they are charging hell of a lot of money, which is not right. Then comes, shortage of the drugs. We have never planned for such kind of a situation that we'll have such a huge pandemic. I would like to say here, in such a situation, doctors and paramedical staff and the nurses or the hospital administrators alone should not be targeted. Not that we should target others also. What I am trying to say is, where is the planning? You cannot plan things sitting in a chair in a room. So our authorities, our officers, our politicians, have they got some plan up their sleeves? Is there any dedicated plan for that? In case such a situation arises, what are we going to do? Can we activate such a system? So sitting in a chair and dishing out orders, I have given orders. People say, I have given the orders. The orders means nothing. You have to go around to the street, to the village, to the hospital, watch them. You cannot say you hold an inquiry against the doctor in the hospital and this lapse and that lapse. What are you doing? Have you ever visited the hospital? Have you seen the muck around? Have you seen the streets? How are unhealthy? How are you see the cattle moving around? Isn't it a invitation to diseases? One must do the job first and should not point accusing fingers at others first. Doctors are working. They are fighting for their lives even. There are doctors who are not taking food even for 24 hours. To hold inquiry, this and that, and then of course our public people, in spite of the best efforts, they are after the neck of doctors. And nobody protects them. The law doesn't protect them. It is there. Law is there. But nobody comes to their rescue. How do you expect such people? You can yoke them to do a particular job. But have you ever gone among them? How do you help them? How do you motivate them? How do you encourage them? No, nothing of that sort. Sitting in an office, going to office in official car and coming back. Sitting there, I've given the orders. The orders means nothing. I'll repeat that. So kind of go among the people. Unless you go to the people, you will never understand their sufferings. By and large, we people know the sufferings of people, but most of us come such backgrounds from rural areas, the villages, where financial conditions is not good. Realizing all those things which you have suffered in your life, the poverty and things like that, that doesn't give you an excuse that now you have to sit comfortably. Please go back to the people from where you have come. You must see their plight. I have given the order. It's not a solution to the problem. That's what we have seen. That, you are trying to pass on the buck ultimately to the doctor, and crowd comes. Even this kind of atmosphere, and the hospitals are damaged. Tell me, what is the security of doctors when a huge crowd of 50 people come? Have you got a mechanism there you can protect doctors or their life and property? No. Kindly think over this and come up with dedication. Unless you work in the field, unless you slog, these kind of pandemics will keep on coming. You have to make the people disciplined. Why don't you take action against them? If somebody is not putting on masks, hold them up. If somebody is, having a large gathering, stop it. You educate the people, but nobody goes. You have to set an example by going among the people. Now, what, striking problems we have experienced after this COVID. We are short of hospital beds. We are not prepared to accept casualties in case pandemic strikes us. We don't have sufficient beds. We do not have sufficient medicines. We do not have sufficient ventilators. And when we procure ventilators, does anybody know that these ventilators are they in functioning state? Does somebody know to operate it? Does somebody take it, note it down the register, invoice, write it down, note the batch number of the parameter, monitor, the ventilator, whether it is not replaced? Sadly, I have observed this fact in my life and I've checked it. While I was working in a civil organization after retiring from army, the equipment was procured, and after 2 months I said, show me the batch number. I want to see that register. We caught people who replace the equipment. The equipment is lying, then they say that the trained manpower is not there. Whose job and responsibility is there to train people to utilize the ventilator or some other gadgetry? So therefore, each and everybody is responsible for training his people, maintenance of the equipment, with purchase of medicines. And when we purchase the medicines, we call for tender inquiry committee and this and that, tenders, and then make a comparative statement, and we give order to a vendor whose quotations are the lowest, and he charges you the maximum because he is putting the three front men. So therefore, when we buy medicines, we have seen You buy good quality medicines from good companies. They give you medicines at a cheaper rate than this standard business inquiry committee. When we go to buy something in the market, do we flow tenders? We go to a shop. We see what is the quality of the goodie which we want to buy. Similarly, when you want to buy the medicines or you want to buy the equipment, go see the quality. Take four people around. It's not one man's. You sign the supply order. I've seen the whole supply order signed. We know we have gone through this stage, but nobody can target us for our uh, honest conduct. So what I mean to say is that be prepared with the equipment, medicines, logistic, training, and everything. Whenever some costly equipment comes, there are equipment which cost about 100 crores rupees to the government. It's not functioning. A malfunctioned equipment was installed in a place, and no action was taken against that guy. So up the chain and down the chain, whatever you call it, please, the one thing which is lacking in our country is sitting on the chair and not going around and seeing. Does anybody see the equipment? Does anybody see the state of the places where we are going to have patients, the hospitals, or otherwise also, in other fields of walks of life also? Then I have got another point, is that we must prepare our youth for future in all aspects. We must train them in improving their health, their physical standards, and even they must be given a military training. We do not know what kind of things future holds for us. So therefore, it is very important that we must raise. I find lots of people and young people having obesity. They never go for a walk. They do not know what kind of food to eat or not to eat. They indulge in excessive drinking and smoking. So a general awareness has to be brought in where we have a healthy population. Indian population is by and large a young population, but with this kind of a pandemic, which when it strikes, our elderly people are going, and it started striking our young people also. So it is a very serious threat towards civilization, to our country, to neglect the health, the people particularly of our children and young youth. And finally, I would like to say is that this virus has started going to the villages also. And villages, you'll be surprised, they are not aware even now. As educated people or urbanites who know the one should put on masks and how to keep yourself safe. In the evening, they are still sitting, I believe. They'll sit around the village chopal or something, and each one of them is sharing that hookah. So, so it's an unhealthy practice. But somehow the villages in our country are definitely lagging behind. We have to give them health education, prevention of health. First thing is the disease should not happen, but preventive aspect is not there. We have got an excellent public-private enterprise in our country, Ayushman Bharat. It is such a great noble institution. It exists nowhere in the world. It has helped millions and millions of families. But our all activities are generally centered around urban areas, and there's nothing in the villages. You don't have ambulances there, you don't have doctors there, you don't have medicines there, you don't have beds there, and the hospital or PHC, primary health center, is about 20 kilometers away. And remote areas, mountain areas, the problem is much more difficult and alarming. So we must improve our health services. We have a national health mission. The figures are there. There have to be PHC, there have to be urban centers, there have to be community health centers. But actually on the ground, things are a little different. So therefore, we must lay more strength. We are, almost spending about 1.6% of our GDP on health, where Germany, Britain, European nations, they are spending about 7%, 8%, 9%. So we are depending totally on pre-existing public and private. Now the private corporate health centers, or whatever you call, they are located in metropolitan cities and urban areas, not in the villages. So our villagers, they are lagging behind in all kind of things, and they even do not know. There are some of them are not aware about immunization also. There is a state of affairs. So therefore, just because of there's illiteracy, and it's surprising, the countries and nations which were far, far behind us in development. Now, see the countries like Malaysia or Singapore or Korea. Japanese were destroyed totally after Second World War. Germany, Europe was disrupted. But where are they? If you study there, I've read this thing, how they have been working. They have eliminated those politicians who led the war. They said, you fought the war, now you go out. They brought in people who were dedicated, the staff. So, in our country, the greatest enemy of our people is illiteracy. We do not have good schools, we do not have good teachers, we are not aware of, prevention of the health. So therefore, how don't you expect that the villages will be able to, save themselves from such diseases? And this virus has started striking the villages also. So one of the things which I'll give another, I'm writing a paper about it, that our social and political system, it requires change. We have to exclude and separate the urban administration, urban health services, urban administrative services with the rural one. They have to be segregated. And finally, I would like to say is, despite our states are so densely populated, one state is having, a population of 210 million. Some states are 10 million, some states are 100 million. So therefore, can you imagine such a large population, can it be tackled by one kind of authority? So therefore, it has to be thought by people of India that they should have such kind of states which are manageable, which have a manageable population, so that people get the best thing. And people must participate in their own future, in their own day-to-day lives. Everything cannot be thrust on officials or the doctors or this officer, that officer, and things like that. So things have to move on in a systematic way, in a planned manner. You have to involve the people, you have to educate them, you have to listen to their problem and grievances by going to them at the doorstep delivery of each and everything, and extracting work also. With these words, thank you very much, and I hope I have been useful. I have no financial or commercial interest in making such kind of talks. However, I request you that my viewership should increase. Okay, thank you very much, and all the best wishes to all of us, and God bless our country, this great country, our motherland. This is everything for us. So that kind of a spirit should be there in mind, and a sense of service to others. And one has to earn money, but the profit should not be the motive. And I again pay respects to my colleagues, dear ones, who work day and night, who are working on Sundays also. They never take rest. They work in the hospitals, they work in one place, then go to the second place, and they deserve a lot of congratulations and a lot of support. Thank you very much, and God bless us again. Thank you very much.